Hello, and thank you for joining us today. My name is Stephen Perlin, and I am here today with Dr. Mary DeGuardi, and thank you for joining us. Now, recently, early last week, the CDC approved a COVID-19 vaccine from Pfizer for children ages 5 to 11. Now, we know that brought up a lot of questions for parents and caregivers who are hoping or watching today to get these answers. And so that's why we have Dr. Mary DeGuardi with us, because she's going to talk to us and give us the answers that we need so we understand a little bit better about these new vaccines for the kids 5 to 11. So Dr. DeGuardi, first off, thank you for being here with us today. We appreciate it.
Sure.
Talk to me a little bit about how did the pediatric dose of the COVID vaccine come about, and how was it developed, and where we are today?
Sure. Well, thank you for having me today to talk about this important topic, because certainly we've been waiting, and a lot of families have been waiting for this vaccine to come out for the younger population. The 5 to 11-year-olds we know often have very mild symptoms of COVID, and so they can often drive the pandemic. Because they don't really feel that sick, so they're out and about, they're visiting relatives and friends, and so the virus spreads. And unfortunately, some of the people that catch the virus are going to be the ones that get very sick from it, and that's why vaccinating this population is so important. There were over 3,000 pediatric patients in this age group who received this vaccine as part of the big study that Pfizer did. And keep in mind, this was an international study. This is not just what's happening here in our country. This study had participants from all over the world. And the vaccine was found to be 90% effective. And of the 3,000 children who received the vaccine, none of them had any serious side effects. So that was very, very, very encouraging. And we were very, very happy to see that they did so well. They also studied a lower dose, which I think is wonderful, that they were able to prove efficacy with 1/3 of the adult dose. So by using 1/3 of the dose, and in my mind that translates to potentially less side effects. If the dose is lower, you're getting less of that into your body, then you're not going to react as strongly. So I think that's really encouraging and reassuring for me.
Yeah, I think it makes it a little bit easier on parents knowing that their kids might not feel as much after having as much symptoms, because I know that's always on their concern. Obviously, you want the best for your kid at any time when you're dealing with something like this.
Yep. The most serious side effects they really saw was sore arms, low-grade fever, kind of like what you would see after a flu vaccine. But I know a lot of parents have been concerned about the heart inflammation that we saw in some of the adolescent males and young adult males that received the vaccine, and none of those cases were reported in this population. So that was very encouraging.
Fantastic. And now we're talking about the Pfizer vaccine, obviously, for pediatrics.
That's right.
This time there's not Moderna or J&J, right?
That's correct. And, in my mind, I think that's encouraging that they're taking their time making sure that these vaccines are safe. And Moderna is not even approved yet for the adolescent group, nor is the J&J. So I think we just have to go with what has been proven to be safe and effective and wait for approval for those other vaccines.
And like you said, it's very encouraging, the idea that they're not rushing this along to get it in there. Pfizer obviously took their time, and Moderna, J&J are doing the same to make sure that it's going to be safe when it eventually, if it eventually comes out for the pediatric, the child age kids.
Yes, that's true. And they did a 3-phase trial, and the reason they were able to do it a little more quickly than it typically takes, was that they overlapped the phases of the trial as they were doing the studies. But if you think about it, I mean, the Pfizer vaccine's been out for almost a year now for adults. So, the adult population as a whole has really done very well with the Pfizer vaccine. So that's encouraging also.
Absolutely. And obviously our next step would be the kids, herd mentality or herd immunity and everything.
Right.
Now, with the children, why is it so important that they get vaccinated? We touched on this a little bit, but obviously it's good for them and for society on a whole.
Yeah, again, with the kids being in school, we know how difficult it was last year for children not to be able to be in school with their friends, and to learn in person was really so difficult. And to be able to keep schools open safely, to allow students to be able to go to school and be protected and not worry about spreading COVID-19 to maybe potentially some of their classmates who maybe are immunocompromised or have risky conditions that might put them at higher risk for hospitalization. And we know that over 8,000 children were hospitalized with COVID-19 since the start of the pandemic, and there have been almost 150 deaths. So again, you ask those parents of the children who suffered so terribly from COVID-19, what they think about the vaccine, and I'm sure they'd say get these kids vaccinated. I think about the holidays coming up too, and being around grandparents and elderly people who may or may not be vaccinated, but sometimes the older population we see with the flu shot doesn't necessarily, the vaccine doesn't provide the protection that you would expect in a younger person. So who wants to be the little grandchild that gave their grandmother COVID-19 and the grandmother winds up in the hospital? I mean, I just think if we can avoid it through vaccine, it's an important thing to do, so we can celebrate the holidays safely and not worry about making other people seriously ill.
Which, I mean, obviously this is supposed to be a joyous time of year with the holidays, Thanksgiving,
right.
Hanukkah, Christmas, all these holidays coming up that we spend with our family. We don't want to make it a nervous or, a scary one as well.
Right.
And like, as you mentioned, maybe kids aren't showing as much symptoms, but they do rather have the ability to spread it. So while they might not be getting overly sick from it, which is great, obviously we don't want kids to be sick,
Right.
it is something that they can bring to their, like you said, grandparents or parents or anybody else, any other loved ones.
That's right, Steve, you've got it.
And that's the big thing, I think, because we want to obviously stop the spread, and this is another way that we could do it.
Exactly.
And now we talked obviously about the benefits. Are there with obviously minor symptoms coming from COVID in general for kids, is there anything to worry about there?
You mean with the vaccine or with the illness?
With the illness in general, I'm sorry.
Yeah, I mean, certainly for most kids that get COVID-19, they're going to have a mild illness. They may miss a few days of school, cough and cold symptoms, fevers, things like that. But as I mentioned before, there's a chance they could be hospitalized. There's a chance they could develop this multi-inflammatory symptom illness, which results in long-term complications that could affect the organs of their body, like their heart and their kidneys and things like that. So, I mean, there is risk there. So I would say it's like playing Russian roulette, right? We get the flu shot. I get the flu shot every year. I've had the flu before. I've made it through. But what I don't want to take that chance that this time it's going to make me really sick.
Oh, yeah, absolutely. And that's a very good point in itself. And now the vaccine, we talked about this, I think, a little bit. You mentioned, is it approved for children with suppressed immune systems, somebody that might be immune compromised?
It's approved for all children ages 5 and up. And I would say if parents have a child who they're wondering whether their specific child, because of underlying health conditions, should not get the vaccine, they should. Usually that's going to be form under the realm of a specialist who would answer that question.
Oh, okay. So that's who they should reach out, obviously, and
Yes,
get
to
as
their
much
provider.
information. Yeah.
Exactly.
And now, talk to me a little bit about what parents can expect when they bring their child in for the vaccine.
Yeah.
Obviously, as adults, we know the process. We get the card. We sit a little bit.
So it's going to be similar for the children. The vaccine is going to be offered through the UHS dome that's behind the UHS Vestal Walk-In. In fact, coming up in a couple of days on Veterans Day, when the kids have off from school, there's going to be a vaccine clinic all day, and parents can sign their children up through the UHS website. This is all sort of steamrolling in, so we're in the process of setting up clinics in the pediatric offices as well. They may be late afternoon or early evening clinics like we do with the flu vaccine administration that we do in the fall. We may do some Saturday clinics, but I would encourage parents to check the UHS website. That should direct you to available places where you can sign your children up to get the vaccine. You can also call your pediatrician or your family practice provider's office. I know our office was keeping a list of parents who wanted to get their kids vaccinated, and we're reaching out to them to help them get scheduled. So if you have any trouble scheduling on your own, please reach out to your provider, and they should be able to assist you with that.
Yeah, absolutely. And just to be clear, that website that you should be going to is nyuhs.org. And just to be clear again, the Vestal Dome at UHS Vestal, that's right on the Parkway across from BU, and you can't miss it, that dome structure. As soon as you pull in, you'll see it immediately. Thank you very much for joining us today, Dr. Gordy. As she mentioned, a very important thing we don't want to miss, once again, is that clinic happening on the 11th, this Thursday, Veterans Day, for kids. I think it's 5 to 17, correct? I think it goes to a large range for everybody, and we just want to encourage you to make sure you sign up, or you get to nyuhs.org.
And I just want to make sure parents understand that we're being very, very safe and careful, because the pediatric dose for 5 to 11 is lower. It comes in an orange topped vial versus the adult dose, which is in the purple top. So you're going to get separate signage. You're going to get a purple sheet versus a orange sheet depending on the age. So we're really trying to make sure we keep it separate, so everybody gets the dose that is appropriate for their child.
And you're saying now it's, the ages 5 to 11 is a separate.
Is the orange, because it's the lower dose, and then the purple vial is for the older folks.
Oh, okay, there we go. That's good to know too. That's important information.
The more parents know about what their child's getting, the more informed they are, the better. It's for safety.
Oh, yeah, absolutely. Yep. And these are not things that we want to make mistakes on. So the more we know, obviously, knowledge is power always. Well, thank you very much, Dr. DeGuardi. I appreciate you being here today. Anything else you want to make sure we get across?
I don't think so. If you have any questions at all, please call your provider and we can direct you. Okay?
Yep. Please don't hesitate to reach out. And once again, that website, nyuhs.org, we have all the information right there for you, so you can sign up, register, and learn more today. Thank you, everybody at home, for joining us. We appreciate it.
Okay.